Hello, this is Representative Pam Powers Hanley. Welcome to my podcast, A View from the Left Side. For many years in the Arizona House, my seat was on the far left side of the chamber. As a progressive Democrat and one of the most independent representatives in the House, I always believed that was a fitting seat for me. This podcast features in-depth interviews with newsmakers from all walks of life, as well as political and social commentary. Thanks for joining me on the left side today. My podcast today focuses on the COVID-19 pandemic. It was recorded during the week of September 20, 2021. Rather than having a commentary to provide an introduction to the topic today, the entire podcast will focus on my two interviews. The first interview is with a seasoned public health professional. He's going to break down the science, the medicine, the fake news, the politics, and the personalities. My second interview is with a young paramedic who has been working on the front lines of the pandemic. Her tragic stories provide a poignant balance to his science, data, and politics. My guest today is Will Humble. He is the former director of the Arizona Department of Health Services and the current executive director of the Arizona Public Health Association. During the pandemic, in my opinion, Will has been a voice of reason on Twitter and social media, and I've been following his comments for the last year and a half. This is why I invited him today to give us a little bit of an update on what's going on with the COVID-19 virus in Arizona now, more than a year and a half after we shut down the government back in March 2020. We've gone through several waves of the pandemic in our state and across the country. Before we talk about what's going on today with COVID in Arizona, Will, how about a little bit of a brief history of where we've been?
Yeah, well, thanks. And first of all, thanks for your leadership, Representative Powers Hanley, for being a voice of reason in the state legislature. Your voice really makes a difference on the health committee and within your caucus. And so thank you for the effort that you put in to represent your district and the people of Arizona. So I'll start with the very beginning, and that's where they actually did, I think, a pretty good job. Back, if you remember, in March and April, we had the very first stay-at-home order that the governor issued, and he took a lot of flack for having a lot of exemptions in there around, physical activity, essential businesses, essential services, and so forth. Other states had more rigorous stay-at-home orders. I supported what they did in terms of the exemptions. I thought it was well crafted. I think it was modulated. I don't think it went too far. But I do think that it had the right kinds of exemptions for essential services. And there was a lot of grief. He called golf courses essential. Remember that? And I didn't beat him up for that because, look, it's an outside activity. It's something that you can do safely. It's unlikely to spread the virus because it is outside. And we did by then know that ventilation and where you are made such a difference. And so I think that was, if there was a period of time when Director Christ and Governor Ducey did a good job, it was really in March and April. And then I saw a major turning point in the way they were handling this pandemic. And it ended up being quite lethal, quite honestly, in early May. And that's when former President Trump came to Phoenix to visit Honeywell up in Phoenix, where they were making N95 masks. They converted whatever they were making at Honeywell to mask making. And to me, that was the turning point when their decisions started to be counterproductive and harmful. And we came out of that stay-at-home order lickety split. And I didn't object to the May 15th end to the stay-at-home order. What I objected to was the fact that there was no enforcement of any kind of mitigation measures on May 15th. It just ended. And everyone was expected to just voluntarily follow CDC mitigation measures without any kind of compliance mechanism or enforcement. And so what you saw is that bars and nightclubs, though I'll put those in a category by themselves, bars and nightclubs did whatever the hell they wanted starting May 15th. Restaurants too, but restaurants are less of a problem than bars and nightclubs. And you look at the data, it's really clear. Bars and nightclubs were doing whatever they wanted. Young people were going out partying in the urban centers. That was starting chains of transmission that ended up causing the horrible spike in cases where Arizona stood alone as being the worst in the world in July. And that was a direct result of the decision by Governor Ducey and Director Christ to come out of that stay-at-home order with zero mitigation, zero enforcement, and the bars and nightclubs started those chains of transmission. Now, the young people that go to those bars aren't the ones that died. They started the chains of transmission that killed older people. That was a direct result of that policy decision. And so they still suggest that it was bad luck that we ended up where we were. It is not bad luck. It was a choice they made. Now, I will give credit. It came too late, but eventually at the very end of June, the governor in a press conference, and by the way, that press conference, he knew that he had blown it by then. He looked almost kind of like Richard Nixon at the end, where he was just sweating. And you could see that press conference where he knew that they had made big mistakes and Arizona was headed off the cliff in July. And that's when they did what they called the pause of the bars and the nightclubs and had restaurants go back to takeout service. And that intervention reduced transmission by 80% within 6 weeks. So that showed right there, that intervention was a terrific natural experiment that was really successful. And in fact, they wrote it up. They being the state health department wrote it up in the CDC's morbidity mortality weekly report, which showed the dramatic decline in cases. And so at that point, we built the evidence base to show that if you curb transmission in bars and nightclubs, you save the lives of seniors who will never have gone into a bar or nightclub, or maybe not in 50 years. So that was successful. We came out of that pause of the bars, restaurants, and nightclubs in August, and they made the same mistake again. It was the same mistake. Governor Ducey, Director Christ came out of the pause. In order to open back up, they had to sign an attestation, but there was basically no enforcement of those attestations. And so the bars and the nightclubs started back up gangbusters. And the only time any of them ever got in trouble was like when a journalist from Channel 3 or one of the news stations down in Tucson, it'd be Channel 4, 13 or somebody, there'd be out there showing video of a huge party on a Saturday night, and they would get in trouble, right, like with their liquor license or something. But it was only to quell the public image part of it. It wasn't a real enforcement program. It was designed to make it seem like there was enforcement. That mistake, they did that mistake again, and that led to the increase in cases up into November, December, January. If you ask me, what, Will, do you think is the single most lethal decision that Ducey and Christ made during this entire pandemic? I have to say it was doing nothing about bars, restaurants, and nightclubs right before Thanksgiving. They knew we were headed for exponential spread. This ASU biodesign team, who had been remarkably accurate throughout this whole thing, were saying we are going exponential and it's going to be very lethal. Joe Gerald down at U of A was saying the same thing. I was saying the same thing. The evidence was super clear. We were headed off a cliff, and Director Christ got on the news over and over and over and over again and said, it's small family gatherings that's causing this. It's not bars, restaurants, and nightclubs. It's small family gatherings. She said it over and over, despite the evidence that they created and published in the MMWR showing that bars, restaurants, and nightclubs were the dominant causes of chains of transmission. And that is what led to the exponential growth of cases and deaths in December and January. And that decision right there cost the lives of between probably 5,000 and 10,000 people. That decision, that was on them. That decision, I don't know how they sleep at night. When they look back at this 20 years from now, maybe they'll have a way of justifying what they did, but I sure wouldn't want to have that on my conscience. And they knew it, because remember, the data from July showed what would work. And they just kept saying it's small family gatherings, when in fact it was transmission chains that were starting in those nightclubs and bars, and to a lesser extent, restaurants. That led us into December, January. That led to the era when vaccines became available. At that point, I think the big mistake had to do with the appointment system that the state health department rolled out. Many seniors needed help because it was so counterintuitive to make their appointments. Well, I'm an example. My parents could have never made that appointment. I think the vaccine rollout was less effective than I think people give the state health department credit for, because of the way that they, through the governor's office and the spin that they created a buzz around, the State Farm Stadium and the other pods, which did okay, I guess, but it was all hands on deck to try to rehabilitate the image of the governor and the health director during the vaccine rollout. And it was a nonstop PR campaign. Nevertheless, vaccine supplies increased. President Biden, through the pharmacies, which I always thought was a key to get the vaccine out to pharmacies so people didn't have to go to those big complicated pods. The vaccine supply increased markedly throughout March. And I guess you could say, here's where we are. I have to say, without the Delta variant, I think this podcast would be about something else, probably, because I think we would have achieved herd immunity by now. But the Delta variant is so much more transmissible that now we're in our fifth wave. And honestly, I think if there's not a new variant that comes out of the developing world that escapes the immunity that we've all acquired through either infections or immunizations or both, I think this is probably the last large wave that we're in right now. And then we'll transition into what we call in epidemiology, it becoming an endemic disease, meaning there will always be 200, 300, 400, 500 cases per day coming in, but it'll be manageable when it comes to the hospitals, and people will continue to die. And the people that will continue to die will be the people that have chosen at this point not to get vaccinated. Earlier on, there were a lot of issues with health equity, vaccine availability, lack of access in some of the lower income zip codes. Most of the county health departments, especially PEMA, did a great job setting up mobile units and getting the access available out there. The pharmacies all have it. So at this point, I would say the biggest public health issue we have are those persons that are getting their information from people like Tucker Carlson who have decided not to get vaccinated. And I just don't think that, yes, there is a health literacy component, a language component to this, but by and large, this is, and I get grief for saying this, but it's true. This is now a pandemic of the unvaccinated. By and large, there are people with immune compromised systems that are, at risk still and will always be at risk. But by and large, it's because of misinformation and the fact that this whole pandemic, and in particular the vaccine rollout, has been so politicized. And I'll add one editorial comment, and then you can ask me some more questions. It's kind of interesting that if you look back at the Trump administration, they made so many terrible decisions that were so harmful throughout this pandemic. But the one thing they got right was the vaccine. They worked with those vaccine manufacturers. They took the financial risk out of the system. They removed the barriers to production. They paid for the research and development. They paid to manufacture the vaccine before it was even created. Everything that and I will not use the term they used from Star Trek, which branded what they did, but it was good. The one thing that the Trump administration got right was the vaccine. And the one thing, well, not the one thing, but one of the main things that the persons who voted for him don't trust is the vaccine, which is the part that he did well on, that I don't think I'll ever really understand why people who support him are rejecting his crowning achievement.
Having a background in public health and working in research for so many years, when he said, I'm going to get this vaccine done in, so many months or so many weeks, I'm like, oh yeah, right. I totally didn't believe it, but I was shocked that it worked, and it worked so well. I was really surprised, and I'm glad I got vaccinated. And I actually got tested a few weeks ago at the U of A, and I have antibodies. The difference in the population and the different groups that believe that COVID exists. There are colleagues of mine at the state legislature that many times during 2021, they got up and pontificated that it's just a hoax. And I think there's a percentage of representatives and senators in the state legislature that never got vaccinated because a bunch of them have gotten sick. I'm flabbergasted with the fake news, especially fake news from people like Tucker Carlson. It's hard to even listen to the lies sometimes. I just have to turn it off.
Yeah, there's one thing about this. I think we're really fortunate that a natural infection with the virus provides pretty good immunity. And if that were not the case, that would be really bad, because the persons you just described, the people that don't believe that this is real, got infected and recovered without getting a test. Probably a lot of them are not going to get vaccinated, but they would benefit surely from, getting a vaccine. It really boosts the antibody and the T cell effectiveness, but they're by and large protected from becoming infected again and spreading it to others. And so we're fortunate that the non-believers, if you will, end up getting infected. And that does actually, it's really a vaccine. they got vaccinated the old-fashioned way, the way they used to get vaccinated in the 1800s. And before that, through the history of mankind, it was you got infected and the people that survived lived and they had immunity. And the people that died, well, they put a cross on them at the graveyard and moved on.
What do you think about what's going on with the schools? I mean, I thought that it was a little bit risky to open up the schools and then not have any guidelines really for vaccinations of the staff. I have 3 granddaughters who are under 12 years old who can't be vaccinated, and I'm worried about the school children.
Yeah, well, there's 2 categories as kids, in my view. It's the kids that are 12 and up and the kids 11 and under. And they're different because the kids 12 and up, their parents had an opportunity to get them vaccinated. Some did, some didn't. It looks like our immunization rate among high schoolers is in the high 40s. So that's half of them. That's not bad, not where we need to be, but it's not 0% like it is with the elementary school kids. And the middle schoolers depends on what grade you're in, So, and I'll use K-5 as just my elementary school cohort. None of them are vaccinated. The only mitigation strategies you have for that population are masked, universal masking, which cuts transmission in a classroom by 800%. So that's an 8-fold decrease in transmission with universal masking. A simple public health intervention. And I'm talking about just in the classroom, not in the playground and stuff like that. So if all you do is do universal masking while they're in the classroom, you can cut transmission substantially, 800%, so that you can really remove the public health risk. And it costs next to nothing. And yet, your colleagues in the legislature, not your caucus, but the other caucus, found it in their wisdom to include that in the K-12 budget reconciliation bill. And the governor enthusiastically signed it. And now we're going to hear from a judge here in the next few days about whether that prohibition of universal masking is going to take effect on September 29th. My personal opinion is Judge O'Connor is going to issue a preliminary injunction or a temporary restraining order that will keep the status quo until she decides the merits of the rest of the case. That's what I expect to happen. And so I think the districts that are masking will continue to be able to mask. An alternative to masking, which isn't quite as effective, but does work, is filtration, where there's a study that shows, and it's a good study too, it was in BMJ, it shows, British Medical Journal, it shows that if you have 2 HEPA filters running full blast on high inside of a classroom, that cuts transmission of the virus 400%. So not as good as 800%, which is the decrease that you get from universal masking, but 400% is a whole lot better than not having filtration. Another option is ventilation. That is, you can't really do that this time of year in the deserts, but as we approach October, propping the door open and putting a fan out and trying to move some of that classroom air out through ventilation can be effective too. So your strategies are simple, universal masking, but because it's become political and because the governor was unwilling to stand with the evidence, which he said he was going to do at the beginning, which he has not done. Now we've got a situation where in a few days, it could be that school districts are unable to require masking. I myself have been of the ilk that this should be a school board decision. There are people that disagree with me on that say it should be a top-down decision where the governor should require universal masking in the classroom. I see that argument, but I'm a big believer in local control. And I think that it's okay for school districts to make that individual call. Parents have access to those elected board members. They can influence the outcome. They may not like their outcome, but at least there's some direct democracy that's involved. How much access does anyone have to a governor? None, unless you're the owner of a billionaire sports franchise or a member of the Chamber of Commerce or a big donor. You have access to a governor. We had some good news this week where Pfizer came out with a press release that shows that their vaccine for kids from 5 to 11 years old was safe and effective, and that they would be turning that data into the FDA shortly.
I don't know. It's shocking to me how things rolled out during the session with the big mask debates and the science denial and, it's just the flu. And how long can they keep this up? I mean, the evidence is not with them on this.
We're going to find out in the coming days more about whether masking can continue within the classroom. I think that's a key. And I really hope that the FDA does a snappy rollout of this vaccine after we need them to review the data. And then we've got to get
elementary school kids vaccinated quickly. And that's up to parents. And those parents will then have an opportunity to protect their kids and give them the best chance for in-person instruction. And really, if that's the most puzzling thing about this whole thing, is that the governor goes on and on about the importance of in-person instruction. And I agree with that. It's one of the few things I agree with him on. I agree. Now, if you believe in in-person instruction, then what you should believe in are the strategies that help you achieve in-person instruction. That's universal masking, filtration, and ventilation, and testing in the schools, and contact tracing. If you do those things, you maximize your chances for in-person instruction. But instead, he prevents school districts from implementing the very most effective, highest return on investment and intervention that we have, universal masking, which causes more kids to go out sick, on quarantine, and miss in-person instruction. So there you have it. What's going to happen is they're going to end up they're getting infected. And that's what's happening. The people who don't believe in the vaccine, who are they're getting infected right now. That's what this wave is all about. This fifth wave is a wave among people who get their information from bad sources. They're getting vaccinated the old-fashioned way, the way people got vaccinated in the 1600s.
Right. I saw there was a press release or something on social media, maybe just like a week or two ago, that, Pinal County is one of the worst counties in the state of Arizona, from what I could tell from the ADHS data. And the Pinal County Board of Supervisors announced that they were going to not take money from the federal government to encourage their citizens to get vaccinated. So, and, they're all standing up there, and you can imagine what they look like. And it's like, oh, yeah, no, we don't need no stinking vaccination.
When I heard about that, I went to the website and looked at the members of the Board of Supervisors, and I was struck at the lack of diversity. They were 5 guys just like me, 5 white guys that are 61.
Or older. And then there's other counties, like Mojave County is in really bad shape. Obviously, the most number of cases in Maricopa, because Maricopa's got so many more people than the rest of us. But the infection rates in some of these other counties, and, I know they're state representatives. And so, here we have like Mojave County with Borelli. Senator Borelli was one of the big deniers. He was one of the ones who went to the Giuliani super spreader event back in November. And Mojave County is one of the worst ones. Yavapai County, I met somebody from Prescott Valley the other day in Flagstaff, and she said she was from Prescott Valley, and I stepped back.
This wave is among the people who've chosen not to get vaccinated. And some are going to live. Most of them are going to live, and some aren't.
Yeah, I looked up the data this morning from the health department website, and it said that so far Arizona has had over 1 million cases, 19,584 deaths, 57.4% are vaccinated, and there's been over 12 million tests. So, we've got quite a bit of death. Before we sign off today, could you talk a little bit about Arizona versus the rest of the country, where we stand right now? It doesn't look like we're as bad as some parts. I look at that map on the New York Times, and I see all that red over there in West Virginia and Florida, and we have some spots of red, but we're not doing great, it looks like, from the color coding, but we're also not doing as poorly as some other areas.
So I have two ways to look at that. Number one, I'll just point out where we are deaths per capita. And we're 7th in the nation, and we've been 7th in the nation for a long time in deaths per capita. The top of the list is New York City, and that's by and large because they got hit first. When there was no PPE, they didn't have an opportunity for that stay-at-home order. To be sure, there was policy mistakes that I think were probably made that played into that as well. New Jersey, same thing. So you see those 2 states stand out as high per capita death rates, but the rest are Midwest states that, like South Dakota and places like that simply never did any mitigation whatsoever. Arizona is 7th on the list in deaths per capita. We're going to probably finish something like 7th. It was because of the policy decisions that Governor Ducey, Director Chris made. That's why. And now they will tell you, and they keep suggesting it was bad luck. Well, it's not bad luck. It's directly related to the decisions that they made to not do anything about the bars, restaurants, and nightclubs soon enough in May and June, and at all in November, December, January. Those were very, very lethal decisions. And I do sympathize with bar and nightclub owners, that fact that, that was hurting them. But remember, they had access to paycheck protection, PPP loans, which took an edge off a lot. In fact, some of them made money on the PPP. So they had PPP, and there was CARES Act funding that went to governors that could provide an additional relief in addition to the Paycheck Protection Program money. Instead, Governor Ducey elected to backfill the state general fund to the tune of $400 million and then come to a press conference and say, well, there's no safety net for people, so we're not going to close the bars. Dude, you backfilled the general fund with money that was intended to provide relief so that you could do interventions in bars and nightclubs. And Director Christ stood there right by him. To me, it's even worse that what she did compared to him. She was supposed to be a public health professional that was supposed to have our back, and instead she had his back. The other part is to say, let's compare ourselves to our like cohort states. My whole career, I've liked using Colorado and Washington as states that are really similar to, we're out west, big geographic regions with one big population center with where most people live, and then lots of rural places. Both have about 10 to 11 electoral votes. So we have the same population. So let's compare for a minute and see how we did compared to Washington and Colorado. We did really bad. The state of Washington had 1/3 the number of deaths that we had. A third. They had a governor who actually cared. They have a governor who used science and a health director who cared and who used science. Same thing, Governor Polis in Colorado. He used evidence to drive his policy decisions. They had far fewer cases, I think about half in Colorado than we had. And it's because they had good governors and we had a bad governor. They had good health directors. We had a bad health director. That's why Ducey and Christ made decisions that let this thing get out of control and more people died. It is not because of our hospitals or the level of care that people got once they got to the hospital. It's directly related to the fact that they were unwilling to stem the chain of transmissions when it really mattered most. I'm just really disappointed. Director Christ was one of my deputies. I promoted her 3 times. And so in that way, I kind of feel in some way partially responsible for this, because had I left her in a cube, she would have never been in a position to be that health director at that same time. And maybe, just maybe, there would have been a health director who would have stood up for public health and science at that time. She certainly did not.
Again, as somebody with a master's in public health who's worked in medicine and public health and research for decades, I couldn't believe the way she was managing this. How can she be a doctor and follow this ideology, this anti-science path that, let's face it, the Republican Party has been on for quite a while, especially the Arizona Republicans. And so, yeah, that's a badge of pride, 50 in education and 7 in deaths across the country. Summer 2020, we were worst in the world. We don't want to be number one that way, or at least some of us don't.
And sadly, there's thousands of people that have been buried because of the decisions that those two made. And I'll just leave you with this, is that I was the health director. I know what that job is like. I was in that post to do my job, not to keep my job. You work for the people. Yeah, you report to the governor, but you work for the people. In my opinion, she was in her post to keep her job, not to do her job. And once you make that ethical decision that you're going to make decisions just so you can continue to be in the limelight, you've sold out. And she did.
What do you think of Biden mandating vaccines for government workers?
I think it's a terrific idea. Mandates work. Requirements work. So it's going to nudge those persons that were unwilling or unable or hadn't gotten around to it to go ahead and get vaccinated. So mandates and requirements like that do work. OSHA, who's going to promulgate that rule, still hasn't done that. They're working on it. It's clear from case law and from the Enabling Act of OSHA that they do have the ability to implement that. It was bizarre that Attorney General Brnovich filed a lawsuit challenging the mandates when they don't exist. OSHA hasn't even proposed anything yet, and yet he files a lawsuit against something that doesn't exist. Well, the whole purpose for that was to just get onto Fox News and Newsmax, where his primary voters reside.
He wants to be our next anti-science governor. So he has to have his street cred right out there, right?
Yeah.
So, yeah, I think it's great that he put in that mandate for the government workers. And I'm also glad that corporate America, I don't talk good about them very much, but corporate America is rolling out mandates in some of their workforces too. And it's like a sick employee or a dead employee doesn't do you any good. So let's try to protect people.
And I think there are a lot of CEOs out there who are anticipating the OSHA rule, thinking, great, now I get to blame him. I don't have to take the heat for making this decision about making people get vaccinated. I just blame the president, because it helps, like you said, with absenteeism and performance and productivity.
Well, we're just about out of time now. Do you have any brief parting thoughts?
thank you for your leadership. Thank you. I know it's not easy to run for the state legislature. You got to go out in the heat most of the time and walk your district and talk to your constituents and go to a lot of house parties. And it's a real commitment. We appreciate the fact that there are people like you willing to get out there and run for office and go down to the state legislature and sit through all that crap that goes on. If it wasn't for you, then and people like you, we would be in much worse shape. So we appreciate your effort and the fact that we do have you as a public health professional down there at the state capitol.
Well, thanks so much for your kind words. There are times when it's really difficult to just say, people, what are you saying? Without impugning anybody, because you can't just say, okay, that was a lie. So it is hard to deal with sometimes. But anyway, I really appreciate all your hard work when you were director of the health department and also now that you work with the Public Health Association. As I said at the beginning, you've been a voice of reason throughout the pandemic. I really appreciate your coming on my show. My second guest for today is Representative Melody Hernandez. She is serving her first term in the Arizona House, and she represents LD 26. She's also a full-time paramedic, and I have been moved by multiple stories that she's told us in caucus and also on the floor of the House. So I invited her here today to talk about what it's like being a frontline healthcare worker. I believe that this will make a interesting juxtaposition to what we have heard from Will Humble as Executive Director for the Arizona Public Health Association. Thanks for joining me today, Melody. First, can you just give us a little bit of an idea of what your typical day is like as a paramedic?
Most of my days now are just spent hanging out in a hospital with the same patient as we wait hours and hours for a bed in the emergency room. We're finding that hospitals are at capacity. Patients who are in the rooms above us, they're still getting treated. And because all of those rooms are pretty much full, it's difficult for them to move patients from the emergency room up to those rooms because they have to wait for a vacancy. I met with some pre-hospital coordinators, and what they told me is that we don't have patients getting as sick as they used to in some cases, but they get sick enough where they still have to stay in the hospital for some period of time until they get better, which makes it difficult whenever we have the same influx of patients that we usually get, with cardiac issues, maybe strokes or overdoses, whatever else is kind of ailing the community. And so that's what most of my days look like, it's just us hanging out and standing in the hospital rooms waiting, or in the hospital lobbies just waiting.
Right, because usually in a hospital, if you go to the emergency room yourself or you are transported to the emergency room, there's a check-in period where you're in maybe even a curtained off room in the ER. And then if you're either sent home or you're admitted. And so what you're saying is that you have to wait with those patients in order for them to be admitted because they're that ill.
So what we're finding too, hospitals go on something called divert. And when a hospital goes on divert, that means that they're not accepting most patients unless they're absolutely critical and they need services, like if they're having a heart attack or a stroke or they're no longer breathing. And so hospitals will not go on divert until it is considered dangerous in their lobby to be taking care of however many patients they currently have waiting. And in my situation, because I am a paramedic, what ends up happening is I'm still considered a caregiver. I can still provide care. I can go, get medications and different resources from my ambulance and bring them inside. And we have different ambulance crews just piling up in the hallway because they see caregivers who can stick around and keep taking care of these patients while they try to handle the high influx of patients that they have waiting in the lobby, because they're trying to get it down from dangerous levels to something that's easier to handle and that's safer for.
So you could have people who are COVID positive in the waiting room or have symptoms or even not symptoms next to somebody who is having chest pain. It's a dangerous situation when the hospitals get full like this because you essentially have a ripple down of care. As you said, the doctors and the nurses who work there at the hospital in the ER are just scrambling to serve the patients who are coming in. And you, since you have skills, are then, normally a paramedic would be basically going in and out pretty much all day long. Isn't that right?
That's exactly it. Expanding a little bit on what you just said, there was this horrible situation where we had a patient who continuously seized even after we gave them a lot of medications. And we went in and our patient was still seizing 10 plus minutes and we were trying to get them to stop. Doctor came right away over to our gurney, assessed the patient and we said, hey, we need more medications. We're running out. This patient will not stop seizing. And the doctor said, I don't know what we're going to do. We don't have any beds for this person. And so we have this actively seizing patient who was pretty young. Thankfully, right away, they made room for us. They made room, they made time, they allocated the resources. But what happens when we don't have that available anymore? And that's what was happening last year in the pandemic when it was really bad and when we didn't have vaccines available. Last year, I saw the most death that I've ever seen. And it's something that I have to live with and think about. I get terrified as I see us getting closer and closer to that again, because I don't want for lives to needlessly pass away anymore, because it's so preventable now. And I think Will Humble is absolutely correct when he says this is a pandemic of the unvaccinated at this point.
It is. They're choosing this path. And one of the things that Will mentioned, it's the Trump supporters for the most part that are the deniers, but we have to thank Trump for really getting the vaccine going. I have worked in public health and research for a really long time, so I was a huge skeptic when they said, oh, we're going to have this vaccine rollout right away. I'm like, oh, I don't know about that. But it did work, right? It does work. I became a believer in the vaccine. And so it's ironic that there's this anti-vax element. And that was really, in my opinion, one of his best accomplishments. And that's what they don't like. I don't know. You can't make this stuff up, right? You are based in Maricopa County. Obviously, there's a lot of cases and a lot of deaths in Maricopa County because there's so many people in Maricopa County. But the rate of death is really bad in some of the rural areas like Pinal County and Mojave County. And then you have Santa Cruz County that's like over 90% vaccinated. I mean, it's really interesting how you have these pockets around the state of who's vaccinated and who's not vaccinated, the rhetoric.
I think it's worth noting that I currently work in Pinal County, and I'm seeing arguably more COVID positive patients who are in pretty critical condition in this area. And I think we have to think about the leadership of the area. We have to think about the narrative that's being pushed within those circles. And so it's a stark difference between when I worked in Maricopa County and what I'm hearing from folks who still work there to what I'm seeing now in Pinal County. It's a huge difference. And it's a worrisome difference, to be honest.
Right. And did you see the news story that the Pinal County Board of Supervisors voted not to take federal money to help encourage their citizens to get vaccinated? No, we don't need any help. We'll just let them die, right? What could go wrong? And, here they are, 5 old white guys preaching the Tucker Carlson, you don't need to get vaccinated. So, yeah, that must be interesting working in Pinal County in this sort of a time frame. One of the things that I've heard of is that the demographics of who's getting sick has changed. Have you seen that?
I'm going to be honest and say I'm seeing a lot of younger people getting sick, because I'm thinking about the folks that we recently transported, and I would say they were all 35 and under for the most part. What's especially troubling about that is that some of these are like young parents as well. And so we're having to take these really sick people away from their kids. We're having to figure out like what they're going to do to take care of those kids. So we're having other folks within the department come in and try to assist with that. So we're grateful for that being available, but at the same time, we're just continuing to tear apart these families and their young families. And it's a huge difference from the population that we were seeing primarily be affected last year. But even last year, I mean, a lot of the firefighters that I work with, they were very young, they're very fit, they're very healthy. We eat healthy dinners all the time. We prioritize, working out and our health, and they were still getting hospitalized. But now it's primarily younger people that we're seeing.
And that's really sad. There was a story just maybe 2 or 3 weeks ago about a young man. He was, I think, under 35, a father. He had 3 kids and 1 on the way. And he was an anti-vaxxer, and he's in Texas, and he was leading rallies against the vaccine and recently died, and his wife put it out on Facebook, because he had a lot of Facebook followers because he was pumping up the anti-vax rhetoric. She's pregnant with the 4th kid. She is not vaccinated. And I'm like, oh my God, what's going to happen to those kids if she dies also? People really need to think beyond their own ideology. I'm sure that you would say that your job today is different from last year and also different from the before times. Is that true?
So I would say last year, the death toll was so high. It was more like we were just showing up at these homes and multiple times a day, we were just confirming that they had passed. And in some cases, the deceased had been deceased for some time. And so there's not much we can do in those situations. But whenever they had just passed away, we would try to resuscitate them. But for the most part, the death toll was so high and expanding so quickly that a lot of the time we were just showing up, we were pronouncing them deceased, and then we would move on to the next patient. We would get another call right away and go to the next one. So it was a fast turnover. And now this year, like I said, the new challenge is that folks are still getting sick, but they're not as sick in some situations. And so now is the challenge of just waiting in the hospital, waiting for a room to become available. So these folks, because they're too sick to stay at home and they're too sick to leave the hospital. So that's the difference. Now it's much more of a waiting game than it was before, which in a weird way, I'm grateful for, because not as many individuals are passing away, but a lot of these situations are absolutely preventable.
I'm sure that you all take a lot of precautions on your job. One of the sticking points has been employers who now want to have vaccine mandates and mask mandates. These are things that, especially the masks, that have kept the healthcare workers like yourself alive through this thing and when working, because you worked through the entire pandemic. How do you guys keep yourself safe?
I mean, we're still wearing, especially on medical calls, and if someone is having COVID related symptoms, we wear everything possible to kind of protect ourselves. So we're still wearing the gowns, we're still, wearing gloves, we're still double masking, we're wearing goggles, we're putting our hairs up in a way. And then as soon as we're done with the calls, we have spare outfit or spare uniforms in the truck. And then we get to the hospital, we change, we get home and we shower and we change again. And so we're deconning as much as possible, but we're still doing the same exact thing that we were doing before. Even though that we're vaccinated, we know that people still get sick. And so we're trying to protect ourselves and trying to protect our families and folks in our lives who may not be making the decision to get vaccinated.
In addition, you guys are still seeing the gunshot wounds and car accidents and heart attacks and all of that, right?
Yes, and you know what? Now that we're coming out of the pandemic, we're arguably seeing more gun violence, which is it's really sad. I've had to watch young folks pass away while we did everything that we could to save these folks. And I had this one horrible incident. She was in her early 20s, and then another individual in that situation also took their own life because it was an accidental gunshot. The fact that these kids had guns on them and that they were at a party and showing it around like it was a cool thing to have, and now we have two young kids who are dead. And so I know that one of my colleagues, representative, Dr. Freeze, same thing, he's seeing the same kind of gun violence. And so he and I sometimes talk about it, and we try to cope and be there for each other, because we know what it's like to all of a sudden have more gun violence as people are coming out of their homes more. We were very confined last year.
I remember that from last year, maybe even about this time last year, where they said, oh, here's how we can solve gun violence, make people stay at home.
Yeah, we were talking about having no more like school shootings and no more like just these tragic, gun violence cases. And now we're seeing it again, and it's something that I've seen in the past, but it's incredibly difficult, and it's hit a lot of us hard. A lot of the firefighters I've served with, incredibly hard, and we just hate seeing kids die. And it's another very preventable thing, very preventable. And we're still seeing everything else you can think of.
So is there anything else you'd like to add before we wrap this up?
Please get vaccinated. If you're listening to this and if you have doubts or you have questions, just get vaccinated. Because like I said, this is all easily preventable. And a lot of folks want to thank healthcare providers, and they want to thank us with pizza and the desserts and the clapping at a certain time. And we love all that. We appreciate that. But the number one way you can thank us is by just getting vaccinated. The number one way you can take care of your families is by getting vaccinated. Because you shared that story earlier about the family with that gentleman who left that family behind. I have seen that so many times in my line of work because of COVID. And just recently, we took this young mom away from a kid who was under 10 years old, and he watched us try to bring his mother back to life. And now he lives without a mother. And so the number of times we've had to tear these families apart unwillingly, it's so preventable. And please just get vaccinated. That's my last piece of advice. It's the moral thing to do. It's the morally, ethically right thing to do.
Yes, keep us all safe. We need to do what's right for ourselves and our families and our communities. I really appreciate your time. I appreciate the work that you do, and I hope people take your advice. Thanks so much for tuning in to A View from the Left Side today. If you enjoyed the show, please consider liking this podcast on social media and becoming a subscriber. This is Representative Pam Powers-Hanley signing off. Until next time, please take care of yourself, stay healthy, and stay vigilant.